Did you know that your skin, nails, and even your breath can quietly warn you that your kidneys are in trouble years before you ever hear the words kidney disease in a doctor's office? Kidney disease is something doctors see every single day, especially in people over 50. But here's the scary part. In the United States, about 9 in 10 adults with chronic kidney disease don't know they have it. In this video, we're going to talk through 13 visible signs of kidney disease that you can literally see or feel in your daily life. By the end, you'll know what your urine, skin, and eyes might be telling you, which normal aging symptoms are actually kidney red flags. When it's time to say, okay, I need blood and urine tests now, not next year. And if you stay with me to the end, I'll also show you how some women over 50 are not only protecting their kidneys with lifestyle and medical care, but also supporting their cellular energy and metabolism from the inside with a supplement, so you're not just surviving, you feel more alive. Let's start where many kidney stories begin, in the bathroom. 1. What your pee is trying to tell you. Sign number 1 is foamy or bubbly urine that looks like soap suds and doesn't disappear quickly. That thick layer of foam can mean there is protein leaking into your urine, something kidneys should normally hold on to. Medical sources list foamy urine as one of the early visible signs of kidney damage. If you see this more than once in a while, especially if you're not flushing with high pressure or using cleaning products, that's your first quiet alarm. Now comes sign number 2, needing to pee several times at night. We call it nocturia. Normally, kidneys concentrate urine at night so you can sleep. But when kidney function starts to slip, your body may push out lots of more diluted urine, especially after age 50. That I'm up 3 times every night to pee pattern is not just a normal aging badge. Early kidney disease can be one of the causes. Sign number 3 is a big, unexplained change in your urine. Very dark, very little, or streaks of blood. While dehydration, medications, or infections can do this too, blood or persistently dark urine always deserves a conversation with your doctor and usually a urine test. Just from what you see in the toilet bowl, you can catch kidney trouble years earlier than many people do. What if your body is also leaving clues on your skin, face, and legs? Clues most people over 50 blame on poor circulation or just dryness? 2. What your skin, face, and legs reveal. Signs 4 to 7. Think about how many times you've said or heard a friend say, my ankles are always puffy, but that's just age. My skin is so dry now, must be menopause. Sometimes those explanations are true, but sometimes it's your kidneys raising their hands and saying, hey, we're struggling down here. Sign number 4 is swelling in your feet, ankles, or lower legs that doesn't go away easily. When kidneys don't filter well, extra salt and fluid can build up in your tissues, especially in the lower body. Medical organizations list swelling of the ankles, legs, or face as one of the common symptoms of chronic kidney disease. If you press a finger gently into your shin and it leaves a dent that slowly fills in, that's called pitting edema, and it's worth checking out. Sign number 5 is puffiness around your eyes, especially in the morning. Some people notice they look like they cried all night, even when they slept fine. That periorbital puffiness can happen because protein is being lost in the urine, and fluid is shifting into soft tissues around the eyes. Now, sign number 6, itchy, dry, or crawling skin that seems out of proportion to the weather. Studies show that up to half of people with more advanced kidney disease experience intense itching, often worse at night. This can be caused by waste products and minerals, like phosphorus, building up in the blood when kidneys can't clear them properly. Moisturizers help a little, but the itch keeps coming back. That's your clue that this isn't just dry winter skin. Sign number 7 is when your skin tone slowly changes, looking more yellow, gray, or darker in patches. As toxins build up and anemia becomes more common in kidney disease, skin color can shift subtly over time. Many people chalk this up to just aging or I must be tired, but combined with swelling or itch, it paints a more complete picture. So here's your mini takeaway. If your legs, eyes, and skin are all acting strange at the same time, it's not overreacting to ask, could this be my kidneys? Next, let's talk about the signs that show up in your muscles, nerves, and sleep, because that's where women over 50 often suffer quietly for years. 3. When your muscles, nerves, and sleep start complaining. Sign number 8 is frequent leg or foot cramps, especially at night. Kidney disease can disrupt levels of key minerals like calcium, magnesium, and potassium, which muscles rely on to contract and relax properly. There are many other causes too: medications, dehydration, new exercise, but unexplained, persistent cramps are a reason to check kidney function and electrolytes. Sign number 9 is restless legs or an irresistible urge to move your legs while resting, especially in the evening. Research suggests that people with chronic kidney disease are more likely to experience restless leg syndrome, in part due to iron metabolism metabolism changes, and toxin buildup. It doesn't just bother your legs, it steals your sleep. And long-term poor sleep further harms your heart and blood pressure, which also affect your kidneys. Then comes sign number 10, trouble sleeping and daytime exhaustion for no clear reason. Fatigue is one of the most common complaints in people with kidney disease. Studies show that early CKD often shows up as low energy, poor sleep, and difficulty concentrating long before more dramatic symptoms appear. When your kidneys can't filter properly, waste products remain in the blood, making your whole body feel like it's running through mud. So if your nights are full of cramps, creeping legs, and tossing and turning, and your days are full of yawns and brain fog, it might not just be busy life or getting older. Now let's move to a set of signs many women shrug off for far too long: the way food tastes, smells, and feels. Visamana 4, when food, taste, and weight start changing. Think about a time when your favorite food suddenly tasted off. Imagine biting into chocolate and tasting metal instead, or smelling your own breath and thinking, why does it smell strange, even though you brush and floss daily? Sign number 11 is a metallic taste in your mouth or breath that smells like ammonia or urine, sometimes called uremic breath. As kidney function declines, waste products like urea build up in the blood and can enter saliva. Oral bacteria then convert urea into ammonia, which can change taste and smell. Many people with kidney disease report that food tastes metallic or bitter, making meals much less appealing. That connects directly to sign number 12, loss of appetite, nausea, or unintentional weight loss. When the brain senses higher levels of toxins, it can switch on circuits that reduce hunger and increase queasiness, similar to how the body reacts to food poisoning. Medical sources list decreased appetite, nausea, and weight loss as common symptoms of more advanced kidney disease. Here's why this is so important for women over 50. You might already be eating less because your metabolism has slowed. You might think, oh, I'm just not as hungry as I used to be. You might even see weight loss as a good thing at first. But when loss of appetite comes with fatigue, swelling, or changes in urine, it's no longer a diet win. It's a message, which leads us to the 13th sign, the one almost everyone dismisses until it's loud. The INSA 5, the 13th sign. I just feel old and tired all the time. Sign number 13 is when that tiredness becomes constant fatigue and brain fog that doesn't match your lifestyle. You wake up tired. You climb one flight of stairs and feel winded. You sit down to read and your mind can't focus. You feel older than you know you should feel for your age. Chronic kidney disease can cause anemia, low red blood cells, toxin buildup, and hormonal imbalances, all of which drain your energy. Data from large kidney studies show fatigue is one of the most frequently reported symptoms once CKD progresses beyond the very early stages. Here's the dangerous trap. You call it getting older. Your friend calls it menopause. Your family says you just need more rest. Meanwhile, your kidneys might be quietly working at 40 to 50% of their normal capacity. The good news? All 13 of these signs, urine changes, swelling, skin shifts, cramps, restless legs, poor sleep, taste changes, appetite loss, and deep fatigue are visible invitations to get checked before your kidneys reach a crisis state. Now, the big question, what can you actually do if you're recognizing yourself in these signs? Your next steps, simple and clear. Sorry, if even one of these signs felt familiar, start with the basics. Get a blood test, creatinine, eGFR, and a urine test. These two alone catch most kidney issues early, long before they become dangerous. Then focus on the big daily habits that protect your kidneys after 50. Steady blood pressure, less salt, more whole foods, gentle walking, and proper hydration. Small choices add up fast at this stage of life. But here's something a lot of people tell me. I'm eating better, I'm moving more, so why is my energy still low? That's often about your mitochondria, the tiny engines.